Thank you, Shannon. Today I'm joined by Dr. Paul. You're a medical officer of health, and welcome to the show, Doctor.
Thanks. Once again, nice to be back, actually.
Doctor, again, following up on the Health Matters segment, Lyme disease is front and center.
Yeah. Lyme disease is front and center. It's getting a lot of hype and a lot of media. As a matter of fact, I posted something a couple of weeks ago on Facebook and it got like 100,000 views shared and a lot of misconceptions. So I just want to lay it on the line and sort of tell people what the actual risks are and what the situation is. First and foremost, Lyme disease is caused by a bacteria called Borrelia, and the bacteria is transmitted by a tick. Okay, it's called the deer tick, and initially we only saw this in the United States, and now it's kind of moved up to our area. So how do we know that it's in our area? Where over the last 5 years, we've been actually testing the ticks. People have been bringing in ticks in, and we're testing it for the bacteria. Now, a couple of things I want to say. Not all ticks are the deer ticks, okay? And not all the deer ticks themselves carry Lyme disease. But in our area, let's say there was 100 ticks that we tested, about 20 of them would be the deer ticks, black-legged ticks, and about 20% of those, so about 4 or 5 out of the 20, would be positive for the bacteria. So that people panic and say, "Oh, we got ticks everywhere," doesn't mean you got Lyme disease everywhere. Number one. And of course, Lyme disease exists. Lyme disease can cause illness. It can cause infection. It goes into the blood. You don't feel well. It's got a rash. And in severe complications, but if it's not treated, and very rarely, you can get involvement of the heart and the brain. And that's why we worry about it. So let's go back now to our area. So the area of the East Ontario Health Unit is deemed what we call high risk for ticks that carry Lyme disease. Doesn't mean that we have higher rates of Lyme disease. We've been monitoring that as well. So that means that anywhere along the St. Lawrence River, essentially, and all the way up to Voyageur Park and those areas, most of our area, there's a map that we have on our website, is kind of yellow because it means high risk. Even Ottawa is high risk. So why do we say that? So we say that because in the past, what we would do is we would say, okay, bring the tick in, we would test it and see if it was positive. And now we know that there's a significant number, 20% or more. So what we do is we have several things. Number one, we want to do what we call precautions, control of the tick environment. So the first thing you do is on your property, if you put like wood chips around the property, ticks will actually don't like wood and don't like the dry wood, and they won't come into your property from grassy areas. Keep your grass short, obviously. Secondly, use the same precautions you do for mosquitoes. So wear long sleeves, tuck your socks into your pants. DEET, the spray, will prevent ticks from latching onto you. If a tick latches onto you in our area, and you see it, and then so what we say is go back home, take a nice shower, look at all the areas where a tick can sort of attach on you, get rid of it. And if it's your kids, do the same for your kids, same thing for your pets, right? If you do that, and let's say now you were to go out tonight, and you woke up tomorrow morning and found a tick on yourself. If you remove it, throw it away, you're done. You don't have a risk of an infection, even if the tick was carrying the disease. You will only get the disease if the tick has been on you for more than 24 hours. So what we're telling people now, and working with physicians, if you have a tick on you for more than 24 hours, go see a medical help. Go to your clinic, a local office, and so on. No need to test the tick. You remove the tick. The doctor will likely give you 1 dose of antibiotics that will prevent it. The other choice would be take the tick, test it, 2 weeks later, we're not going to do that. We want to prevent it. So if you have a tick on you and you suspect that it's more than 24 hours and it's from our area, go seek medical attention and we can give you antibiotics for that. Okay. So if for some reason Lyme disease develops and there's a characteristic rash, then there is an antibiotic, a longer course of antibiotics. Again, it's rare, but we take these precautions.
Now also, Doctor, summer's here, that means heat, I think. But anyhow, that means swimming pools.
That's right. So we've heard several cases of drownings over the last couple of weeks, I think, locally in Ontario and I think in Quebec as well. Every year we tell people that, backyard pools and beaches and those type of things, they're fun, they're great in the heat, they're a great recreational thing to do, but please be aware, kids should always be supervised around any body of water. And that includes pools, wading pools, even buckets. Kids have put their heads in buckets and drowned, you know. So any pool of water that you see, any body of water, you should take the precautions, obviously. The other thing that people have a fallacy is that, oh, my kid took swimming lessons, he can swim alone. No, especially if you go into a river or a lake that's got a current in it, even professional swimmers can drown in those type of things. So you got to be very careful. Don't over-rely on the fact that you got, you know, swimming. Obviously, if you got younger kids, put the jackets on them, you know, the vests on them. Those little floaties that you get, you know, Mickey Mouse and those type of things, those are not life-saving devices. So you shouldn't rely on them. But the bottom line is make sure the kids are not left unattended. If you've got toys around, remove the toys, you know, and also fence them. Obviously, as you know, if you have a backyard pool, it should be fenced with a latch that locks automatically. And around the fence, we've seen kids don't put toys or anything the child can climb. We've seen kids actually pull a little wagon, go into the pool and drown, jump over the fence. So think about the possible things that can go wrong and try to avert them, because, you know, it's tragic and it's preventable.
And doctor, before we wrap up, we're not just talking big pools, we're talking kiddie pools.
We're talking kiddie pools as well. Kids can drown in 6 inches of water. Yeah. I mean, kids have drowned in puddles, construction puddles, for example.
We're talking health matters with Dr. Paul. I'm Todd Alone for Community Matters.